Ask the Expert, sponsored by St. Elizabeth Healthcare.
Bill designed to fight addiction has just been signed into law into Kentucky. It's going to go into effect this summer.
Medical reporter Liz Bonas is here now with what experts say it means for you at the doctor's office. Liz.
Hey guys, good afternoon. House Bill 333 is designed to fight addiction in a number of ways. But one of the things that it does is it sets prescription limits in the state of Kentucky. Several other states, including Ohio, have similar laws in the works. Today we share how experts at St. Elizabeth Healthcare and those who sponsored the bill in the Kentucky governor's office say that it will help reduce the number of people who become addicted to prescription painkillers.
I think the biggest thing about this bill is really what it does is address the acute patient, patients who are naive to opiates. Those are the ones where you don't want to give them a long-standing prescription because that increases their chance of becoming addicted to one of the most powerful drugs in the world.
The drugs, commonly called opiates, are highly addictive, according to Dr. Larry Kendall. He is part of the medical community along with St. Elizabeth Healthcare who support House Bill 333. The bill is based in part on studies compiled by the National Institute on Drug Abuse, which show that 3 out of 4 people who end up using injectable drugs such as heroin report that their first opioid was a prescription drug. The new bill is designed to work against that by putting, in most cases, a 3-day limit on new opiate prescriptions.
Because what we're trying to do with this bill is actually reduce the number of new patients that become addicted to opiates.
There are automatic exemptions for the 3-day limit, according to Kim Mosier, who is the sponsor of the bill and the director of drug control policy in Northern Kentucky.
If a provider, if a prescriber indicates or deems something medically necessary past that 3-day threshold, they can absolutely write a prescription for chronic pain, cancer, hospice, inpatient prescribing.
For how much?
Well, as much as they need.
Providers, she says, are asked to clarify why there is a need for an exemption. It is also suggested that alternatives for pain besides opiates be considered. So that is an important discussion for patients to talk to their own doctors about.
So that's kind of the point, is that, you know, we have a very easy solution, and yes, the opioids take the pain away, but we are ending up with a huge number of addicted individuals. And, you know, with this bill, we hope to just kind of reset the thinking that opioids are the first line of treatment and reduce the number of individuals who end up addicted to these really dangerous medications.
Years ago, you may recall that pain became what medical providers called the 5th vital sign. It is a problem that should always be addressed. Some think it got a little bit out of hand, and we will continue to follow up as this bill becomes law and hopefully see how it meets those intended goals. As always, we invite your questions for providers at St. Elizabeth Healthcare. Go to local12.com, click on Ask the Expert. Interesting stuff, huh?
It's a really complicated issue, isn't it?
You know, she did bring up that point that there's a lot of things that go into this. This is simply one step.
Thank you, Liz.